Welcome, everyone. The meeting is now being recorded. We have a quorum on the town board, and I would like to make a motion to open the March 18th, 2021 Town Board as Police Commission meeting.
Second?
All in favor?
Aye.
Aye.
Okay, and please stand for the Pledge of Allegiance.
I pledge allegiance
To the flag
of the
of the
United
United States of America
and
and
to the
republic
republic
for which it stands,
one
one
nation,
nation, under God, indivisible, with liberty and justice for all. I'd like to make a motion to approve the agenda.
Second?
All in favor?
Aye.
Right. So announcements. I know, I think there's probably some people here that are interested in hearing about the New Paltz Police Reform Reinvention Commission. We have not received anything from the commission yet. They had a public hearing meeting on Monday. I think all of you were there. When we get the report, we will we'll post it on the website for everyone to read, and it's very likely we're going to have it. Hopefully, we'll have it before the deadline of April 1st, and we'll be voting on accepting it that evening. And you know, some people have asked us to have a special meeting. I am not usually a fan of special meetings, especially for something like this. People tend to miss special meetings. It's not on their radar. And I don't think this is something that we should have a special meeting and then have people potentially miss out on it. So I'm inclined to have it at the April 1st meeting. So with that, if any other announcements, Chief?
Yeah, I have a couple announcements. The first is that our first annual report has been published on our website. We put it up beginning of March. This is our first report. It'll contain a bunch of information in terms of operationally programs that we have and that we run, as well as calls for service, use of force information, arrest information, some budget information as well. So I'm hoping people take an opportunity to check it out. This is something, as I said, we'll do moving forward. This Saturday, March 20th, will be, they're having a New Paltz Opioid Addiction Day. There'll be a drug take back at Village Hall from 11 a.m. till 2 p.m. Members of Oracle, which include Officer Kraus, he's been assigned to that unit, will be there to provide some information relative to Narcan, and anyone can dispose of any unwanted and unused medications. The 33rd annual Easter egg hunt is going to be on March 27th, Saturday 27th. This year they're doing it a little bit differently. There'll be 4 one-hour sessions, 150 people max to each session. This is put on through the youth program, Jim Tinger and his crew. We help out with that. There's still openings for people to register. If you're unable to do that, they're also hosting a Easter stone scavenger hunt at Hasbrook Park. Saturday and Sunday. You can go anytime, complete the scavenger hunt, and then you turn it in at the youth center and you can pick up prizes. And again, there's information available for both those on their website. And then we posted the announcement on our Facebook page as well. And then finally, I just want to give a shout out and thanks again to Chris Marks. He helped us out back the end of February. We ran into a situation of ran out of fuel oil here, or heating oil, excuse me, here. And Chris was able to come to the rescue again and get us up and running. So I just want to thank Chris for helping us out with that. And that's all I have for, and last but not least, the vaccine site at the fairgrounds opened up today. They started at 2 p.m. this afternoon, and starting tomorrow, they're going to be running from 8 a.m. to 8 p.m., 7 days a week out there. And anyone that is eligible for vaccine can go to the state website to register. And that's it.
Great, thanks. I'm actually going to move things around on the agenda a little bit. We have our attorney here. I don't want to keep him waiting while we go through public input. So I'm going to make a motion to go into executive session to discuss matters of personnel.
Second.
All in favor?
Aye.
Aye.
All right, so I'm going to pause the recording and we're going to put everyone in the waiting room. And then when we come back, we will turn the recording back on and readmit everyone to the meeting. So we will see you all soon. The start of the recording, and I'm going to admit everyone. It is now 7:23. Welcome back, everyone. Thank you for being patient. We're now recording again. It is 7:23, and I'm going to like to make a motion to come out of executive session.
Second, Alex?
All in favor?
Aye.
Great. And so I'd like to, we're running really far behind this evening, so I would like to open the floor for public input, but please, Pete, we're going to keep your comments down to 2 minutes because we have other people waiting here to give a presentation or several presentations, and then we still have the police commission, and then we have the town board meeting. So I'm going to, I'd like to, if you would like to make a comment, please raise your hand by clicking on the reactions button at the bottom of your screen, then clicking on raise your hand. If you're calling in, you can raise your hand digitally by pressing *9. And so I'm going to enforce it pretty strictly at 2 minutes because we have a lot of people waiting. So, or you can also just wait and say the same thing at the town board meeting when this is all over. That would be the polite thing to do, but if anyone has a comment, let me start the timer. I'm just going to mute you at 2 minutes, okay? Because we have a lot to do. So maybe I'll give you a heads up that you have 10 seconds left, but Maggie, you can go.
Okay, I'm sorry, I think you mean Edgar, correct?
Well, your name says Maggie, so I like to call people by what they like to be called by. So go ahead, Maggie.
So the 2 minutes start now.
15 seconds ago.
No, it doesn't, please. You know, this.
You're losing time. Just hurry up.
Listen to me, this is very bureaucratic what you're doing, the way this meeting has gone, and now you're using the Zoom meetings to control public input. This is wrong. I will come back on again before, but it's very disingenuous of you to say that you don't have the report. You do have the report. The draft report was sent to you by me, okay? It is posted on the website contrary to what you said. Now, you may argue that the report is not the final report, but you do have a report that you can respond to and that the community has started the process of responding to. So I do not understand. So what I will suggest to you is that New Paltz is on the complaint that two lawyers filed, a statewide complaint, and New Paltz is named on it. I have been in contact with the division of the budget, okay? And what they've informed me is that the deadline that we have of April the 1st is not a real deadline, that because of COVID and everything else, they will accept reports after that. So I consider that what should be done is that the process in New Paltz should be extended in order to have the kind of debate in this community that we've been calling for the past 8 months. I will come back so you don't have the pleasure of cutting me off at 2 minutes, which is a very arrogant part on you to do that to the public.
Thank you very much. Tanya?
Tanya, you're on mute.
A couple of months ago, Chief Lucchese, our group sent you a list of questions that we wanted to discuss with you around policing. And at the time you refused to meet with us and said you wanted to wait until the report was done or something of that nature. Well, we still have those questions. The draft report is done and it's not going to change very much. And we would like to know when you're going to be available to sit and meet with us, you know, to discuss the questions we have about how the police department has been working and some of the data that you have or don't have. So I would like an answer to that.
Are you on the screen?
Yeah.
Where are you?
I'm here. People can't hear me?
Nope, we can hear you.
Okay.
Oh, there it is. Can you please let Maggie in?
Well, I asked the question to Chief Lucchese. Am I going to get an answer?
Sorry, Maggie, I'm trying to find the, can you hear me? I mean, Tanya, can you hear me?
Yes, I can hear you.
You
Now I can.
Okay, you can give me a call. We'll arrange a time to meet.
I will definitely do that. I will talk to people in the group and see when we're available, and then we will get back to you within, we having a meeting in the next couple of days, and we'll discuss it and get back to you by the beginning of the week.
You know, like I said, depending upon when you are available, I'll check my schedule and we'll get together at some point. Absolutely.
Is it better for you to meet during the day or evening or weekend?
Whatever. We'll come up with something. Give me a call tomorrow and
Okay.
I'll be back in touch.
Yeah, I always like to ask people if they have preferences for times, Okay, thank you.
Yep.
Anyone else? Now we'll move on to the first presentation from the New Paltz Opioid Prevention Response Team. And I would like to, make you some co-hosts so you can share the screen. And I'm not sure where Phoenix is. I don't see your,
I see Phoenix.
oh, there you are. Trying to find you here. If someone sees Phoenix, could you make her a there we go. Co-host and okay, so I have Phoenix. You should be able to unmute yourself.
Great,
And
thank
I think
you.
Jackie Cirillo is here and Jim Tinger, and you're all co-hosts. And I'd like to hand it over to you. So thank you for coming and talking to us. And Rob, I'll hand it over to you if you want to make any introductions.
You good, Rob? Okay, so if everyone can hear me okay? Yes? Okay, good, because I'm using a headset and sometimes it doesn't work. So hi, everybody. For those I don't know, my name is Phoenix Kawamoto, and I serve as the town's community education coordinator, as well as the coordinator for the New Paltz Opioid Overdose Prevention and Response Team. I will go into my share screen and let you see this. Great. And folks can see that? Yes? Okay, good. So one thing that I wanted to just say very briefly, because we have several members that I'm privileged to work with as part of this team, is give you just a very brief overview of really who the team is. The team is comprised of not just the town of New Paltz through the Office for Community Wellness. Jim Tinger also serves on that. And we have Family of New Paltz, the Institute for Family Health, the HEAL Initiative, which is the Ulster County grant project that is actually part of Columbia University's grant project that incorporates, it's working with 10 different counties in 4 states. It is a 4-year opioid overdose prevention initiative, and we are part of that. And so we receive a lot of support from them, and you'll see some information regarding the data that we are able to accrue and share as a result of the support through this grant. Of course, New Paltz Police Department, New Paltz Rescue Squad, NP Safe, which Jackie Cirillo will be able to tell you about. We also have SUNY New Paltz Campus PD that is involved, Step 1, which is an outpatient treatment provider based in Highland and Ellenville, and also the Ulster Prevention Council. This prevention and response team actually originated, I believe, in 2012 as part of the Federal Substance Abuse Prevention Grant Project that the town was a recipient of, and I served as the project director for at that time. So it's been in existence, now it's hard to believe, 9 years. It has evolved as the need and as the problem has evolved. We've had to grow to meet the needs and expand our different interventions and strategies over the course of that time. It is also supported, and we're part of a much larger group. So we work with both county providers and responders, as well as a regional network that has now grown to encompass 8 counties in the Mid-Hudson region. So it is a huge network of individuals and organizations, first responders, that is working to address this problem. As we move into the next slides, this really is to kind of help with some of the scope and the magnitude of what we're dealing with at this point in time. I will say very quickly that there is a more in-depth video that is being shared and posted both on the town sites. New Paltz PD will have this. It's being shared publicly through social media that will go into a little more detail than what I will do tonight. So again, these slides are being made available through the HEAL initiative, and the data is provided through the Ulster County Medical Examiner's Office, as well as the OD mapping initiative as part of HEAL. I want to also say, as I've said in the video that I recently recorded, is that this is really hard to talk about. It's hard to hear in a sense, because these are, while it's displayed as graphs and numbers, these are our loved ones. These are members of our community. These are families that are really dealing with heartbreak and very challenging situations. So I really want to make that clear as we move forward in this. What you see is the non-fatal versus fatal overdoses in Ulster County that are opioid specific. So in 2018, and you see 2 colors, the blue and the orange. So the blue is for non-fatal opioid overdoses, and the orange are for those that are fatal. The gray are pending toxicology. So in 2018, the number of non-fatal overdoses was 240 individuals. We lost 56 individuals by opioid overdose death in 2018. In 2019, we saw that number, as far as on the non-fatal side, uptick to 270, with a decrease in the fatal overdoses to 33. And it was at that time that there was a tremendous amount. The HEAL initiative had started. We had mobilized. We were doing pretty dramatic increases at that time, what we thought was dramatic increases in providing fentanyl strips, fentanyl test strips, Narcan trainings in person. There was a lot happening. However, with the pandemic and with people in isolation and being greatly impacted, and the impacts of that also being along the lines of financial, mental health issues, isolation especially, we saw a heartbreaking increase in 2020. So about 55% increase in non-fatal overdoses to 423 last year, but our number of fatal overdoses doubled to 66, with 3 cases pending. What you see in the final column on the right of your screen is really what has been devastating. And since January 1st to date, we have had 81 fatal and non-fatal. That's combined, that number 81. Of that 81, 61 were non-fatal overdoses, and we have 16 fatalities. Well, 19 fatalities, 16 of them confirmed opioid. The other 3 are pending. When we look at what substances were involved, and we'll just focus for right now on this current spike in opioid overdoses. You see multiple colors here, right? So the dark blue and showing 11 deaths is fentanyl, strictly fentanyl overdose. The orange at 2 was for a combination of fentanyl and heroin. The gray is for fentanyl and cocaine. We lost 1 individual who overdosed with that combination. And then the golden yellow is methadone, 3 individuals, and the lighter blue, 2 individuals died by buprenorphine. Now those last 2, methadone and the buprenorphine, are medications that are used for medically assisted treatment. However, methadone has become very commonly prescribed for chronic pain, patients with chronic pain. Some people may recall that in 2013, we lost 2 adolescents in Ulster County and Ellenville. One was 13, one was 15, because they had gotten into their father's medicine cabinet, and he had survived a horrific accident and was had been prescribed methadone for pain. So with the increase in using methadone for pain medication, that started around 2009, we have seen an increase in overdose deaths from methadone from it being used as a pain medication. And the buprenorphine also, while it's used in medically assisted treatment, it is also used on the streets. So that's the first time I'm seeing it showing up in this ME data. The county is divided. When we look at the county, it's been divided into 4 regions to help us understand where the overdose deaths are occurring. And what we see is this again is fatal and non-fatal combined. All right. So Kingston, the city of Kingston is, we've lost 28 individuals in this spike. The central and southern region, of which New Paltz is a part of, that region is at 27 currently, and western Ulster County at 14, and northern Ulster County is currently at 8 individuals. Now, this slide shows you how the region of the county is how it's broken up. So as you can see in the central and southern, that includes as far north as Marbletown and Esopus, Rosendale, down to the Shawangunk, Marlborough, Plattekill, right, and Gardner, New Paltz, and Lloyd. So before I pass it off to Jackie Cirillo, I just want you to know that as we continue to work on this and move through this particular crisis, this time period of the spike, and initiate more strategies, we will be providing updates as they become available. Jackie, I'll turn it over to you at this point. Thank you, everybody.
Thanks, Phoenix. Can everyone hear me? Great. And just like Phoenix said, just seeing that data, that can be really difficult, because those are our friends, our family members, and community members. And we want to talk a little bit about strategies we're putting in place for this. So before I actually go into strategy, I thought it would be helpful to kind of talk a little bit about my role and what I do at the college. So my name is Jackie Cirillo, and I am the prevention coordinator at SUNY New Paltz. And what I do is I focus on the alcohol and substance use prevention and education. a little background about my position. It was actually created through New York State OASIS, which is the Office of Addiction Services and Support. It's through the College Environmental Prevention Grant. It's a 5-year grant and we're in year 4. And there's 19 other SUNYs and CUNYs across the state that receive this grant and have someone in a position like me on campus. One of the main goals of the grant is to implement strategies both on campus and in the community to prevent and reduce underage alcohol consumption and other drug use. So there's different focus areas that I do on campus. One of the things is providing SBIRT, which we call it screening, brief intervention, and referral to treatment. So we're doing proactive screenings for students on campus, and then educational interventions and referring off campus to treatment if necessary. Phoenix talks a little bit about the MP Safe Coalition, mentioned it, and that's something that I head on campus. That's a requirement through my grant. So this is a coalition that has both campus and communities on it. So we talk about what's going on in the community and put in strategies in place both on campus and in the community to help solve some of the situations that are coming up. I also do a lot of social norms campaigning, and what that is we present information about peer group norms in an effort to correct misperception of norms. So kind of talk about, we use data that we get from students to show, no, not everyone is drinking on campus, not everyone is doing this, and just showing other healthy tips that they can do. I work with a lot of members on this to do the responsible alcohol beverage server training, the tips training for our local bars and restaurants. And then I do educational programs and trainings for both students, faculty, staff, and community members. So just to talk a little bit about prevention, because I think it could kind of be, prevention can be many things, right? And so when we talk about different strategies and approaches about preventions, we're talking about it on a continuum. So this means that we're doing prevention for those who not yet have tried any substances, as well as those who are in recovery for relapse prevention. So prevention can be many things. It can be education, it can be environmental strategies, focusing on the access and availability of alcohol and other substances, brief interventions, referral to treatment, recovery support. The Narcan trainings and the medication disposal that we do through this team is part of opioid use disorder and overdose prevention strategies. So to talk a little bit about, I'm going to highlight the medication return units that we do in the medication disposable kits. So we currently have medication return units at the New Paltz Police Department and the University Police Department on campus that are open 24/7. They are located right when you walk in the building, so you don't necessarily have to go into the department to access them. And I think, Rob, correct me if I'm wrong, but since 2013, we've had 3,500 pounds of medication being disposed at the site. What we're also doing is, a couple years ago, we did a Safer Homes campaign. This was prior to me, and this was a partnership with Diedrich's Pharmacy. And what we're looking to do is bring this back. And what Diedrich's will be doing is purchasing medication lock boxes that will be available to the community at cost as prevention for potential opioid use disorder, accidental overdose, and suicide prevention. With the medication disposable units, when COVID started happening and things were shutting down, New York State OASIS, through my grant, provided the community with medication disposable bags. These are actual bags that you can pick up through the it's called doTERRA. That's the company that makes them. And these are safe at-home medication disposal. So what you do is you put unused, unwanted, expired medication in a bag, add water, and then dispose of it normally in the trash. And this is an alternative to dropping off medication at the med return units. And These are available for anyone on campus or in the community. You can receive a kit at home through mail, through drop off, or you can pick up locations in the New Paltz community. So I think that ends with the medication disposal. Is Chief Matt Goodnow on the call? I'm going to pass it over to him.
Jackie, he's not able to
Okay.
make, I know he was at the vaccine site, so he was going to
Okay.
be running late. Rob, did you want to do this part, or?
I can talk about it. If I miss anything, just jump in. So, in addition to our programs, one of the big ones that we've been focusing on is the Narcan training and the kits that we have available. The New Paltz Rescue Squad is able to procure us kits. They're registered with the state, so they're able to get us these kits, and then we're able to then disseminate them after the trainings. And so prior to 2020, we were holding about 6 to 8 in-person trainings a year. These would be on and off campus trainings, and anyone that would attend would receive a kit upon completion of the training. What we ended up doing because of COVID is moving these to Zoom trainings. And so people can go to the website, the prevention team's website, you register for a monthly training. And then at the completion of that training, you can either pick up a kit, have one mailed if need be, or we will drop one off as well. So we work with a number of substance abuse teams in the region. It's not just here within our area. Phoenix, do you want to talk a little bit about that?
Yeah, basically we are able to do door-to-door delivery. We also have at least 4 different locations in the village of New Paltz where people can pick up a kit. We also now have the capacity through the HEAL initiative grant to mail kits to those people whom we cannot deliver to. In addition to the trainings that we do live via Zoom, it's the 4th Friday of the month at 1 o'clock. We're also increasing our community Narcan training drive. Again, Narcan is naloxone. It is a life-saving medication. It unfortunately, right, and it's not the be-all end-all, but it can give many people a chance at surviving the overdose and an opportunity for intervention and helping that individual hopefully find treatment and recovery, right? So we're increasing our community Narcan training drive, and as part of that, we put on the website, because not everyone can come to a live training, right? Whether they're working or, so we have 2 different versions on the website for people to watch a pre-recorded training. One is like really short, 7.5 minutes. This is how you administer Narcan. And then we have a full-length training that is 45 minutes that includes Q&A that individuals can watch. And then all they need to do is click on the Receive My Narcan icon and fill out the web form. And if they're in New Paltz, we are monitoring that almost 24/7. It's pretty close to it at this point. I'm keeping my eyes out. And New Paltz PD has been wonderful in helping deliver kits. Sometimes it's me, sometimes it's Jackie Cirillo, but we're working to get kits to people as soon as possible. We have, again, a small grant that is helping, cover the costs of mailing, which is approximately about $5 per kit by the time but the kits are available for free, no questions asked. And we're also in the process of working on fentanyl test strips also. And we have a resource through the community, through the countywide effort of harm reduction support services that includes the provision of fentanyl test strips for people. I think that's it for me.
Yeah, and I'll take over from you, Phoenix, if that's okay. You know, one of the things that we're really talking about here is to have, you know, make all this stuff that we're talking about as visible as possible, right? I mean, we really want to get all this information out to community as much as we can. You know, Rob was talking about community Narcan trainings. We're trying to get them everywhere. You know, the Rotary's doing it on April 8th. We're trying to get every business location, everybody to get trained. You know, I think when we started this, we really talked about, you know, certain places like, oh, you know, the high needs area, it's everywhere now, right? I mean, it's a need for everybody. This is something, you know, that's important, that I think is in every facet of the community, because it's affecting every facet of the community. The Nalox boxes that we just got, the part of the Ulster County Heal Initiative, there's 7 boxes. And, you know, again, this is like another step towards, you know, it's in the office at the youth center right next to the AED box, right? I mean, it's that now. So it's, you know, at high profile businesses around town at this point, where it needs to be. When you do a Narcan training, you get basically a little bag that has the Narcan in it. You put it in your drawer and whatever. So this makes it, which is great, but this makes it more accessible for the whole building, right? Because everybody knows where the Narcan box is or the Nalox box is at these facilities. And this is kind of the steps that need to be taken, right, for what's going on recently. You know, another thing too, the Good Samaritan law, I think this is really important. I mean, here's a law that's been in effect since 1984 in New York State, but still, you know, people still get worried about, you know, calling the police, calling for help when they're with somebody maybe overdosing. This comes up at the youth center, you know, all the time. Nobody wants to get in trouble. Nobody wants to, you know, be part of a situation where they feel like, you know, it could make the situation worse for themselves. But the Good Samaritan law kind of, you know, protects us from that. And again, this is something that needs to get out more and that we're trying to promote more. And grief support services. So, you know, step 1 in Highland, right? It's a great place to go for grief support. Ellenville has GRASS meetings, which is the grief recovery after a substance passing. You know, and these are different things in the community that's there. And, you know, and just to be able to, we want to put ourselves out there, right? I mean, it's part of the reason why we're here. So, you know, I'll speak for everybody who's on this coalition. They can call us, right? Anybody, our numbers are widely available. And we may not know exactly what to do in all situations, but we know who to call and we know who to direct people to. And I think between all of us that are talking today, I think we all work different parts of this community, you know, in one way or another. We want to make ourselves available and make sure all this information gets out consistently over and over again. You know, we've had so many recent things that's been really disturbing the past few months. And I think a big concern of all of us is that because of COVID and because we're also isolated and we're doing these meetings this way, and you know, it's been really difficult, you know, and again, I'll speak from the youth program perspective. It's, you know, kids are isolating and they're home and we're trying to get them out. We're trying to get them to come back. And, you know, our numbers have been increasing, but still we're wondering where a lot of these people are and what they're doing. And we're trying to contact them. We're trying to reach people. And that goes for adults as well. You know, so it's a real fear that's been growing and these numbers have been going up and it's frightening. So we just need to make those points.
If I could just echo Jim, I mean,
Yeah.
I think one of the biggest strengths of this team is the collaboration and the communication. You know, we're involved, we communicate with each other multiple times a week, if not daily. And the fact that we all have other groups that we communicate with, and all of this is intended to try to not let a case fall through the cracks. So some of the other harm reduction or intervention programs that are operating right now within the county, Ellenville Regional Hospital was a recipient of some grant money, and they have a NET program that's been in place, and it's part, I think, correct me if I'm wrong, Phoenix, but it is part and parcel to the high-risk mitigation team within the county, so that for us now, when we have an OD here in New Paltz, we provide information for the patient's information to this program, and then they're put in contact with members of Catholic Charities for peer counseling and outreach. And this is, prior to that, we had we worked with Catholic Charities and Phoenix's program to create what we call the Port in the Storm, where anybody could come in here to the PD, and in that moment, if they needed help, we would work with Catholic Charities to try and reach out. So the idea is that when you have, it's not just rendering aid, but it's the follow-up that's important. And then it's communicating all of that information to the different groups. And the hope is that you will have fewer cases that will fall through the cracks, and people will get, the treatment that they need. Speaking with Jim, I don't know if you want to talk about the clean sweep or.
Oh, yeah. So the National Drug Take Back Day, right? Saturday, April 24th. So one thing that we're doing clean sweep this year. For those of you who remember clean sweep, we didn't do it last year, as we didn't do a lot of things last year, but a lot of things we are doing now, again, at least on a limited basis. So clean sweep is a community cleanup program that the youth center runs now. And we used to be in St. Joseph's Church, get a lot of different organizations who, take a piece of New Paltz and clean up different parts of it. We're going to do it outside. We're going to do it in Hasbrook Park. That's where people will come, sign up, get their bags, get their gloves, get a snack. But we're also going to have a table there this year for National Drug Take Back Day. So Rob, I guess you're going to be manning that, right, with the police and
myself and Jackie and yep.
Right.
Yep.
Right. Thanks. And collecting like unwanted, unused, expired medications, safely. People drop them off again. It's amazing to me how many people have dropped off their unused medication. I mean, that number you said, over a ton of medications, and to the police station for the most part. So that's, and you can imagine, it kind of, for me, it kind of falls under the umbrella of the Good Samaritan law, right? Because you're not going to get in trouble. It's not something where you're going to be penalized for dropping. It's no questions asked. And the same thing applies that day at Clean Sweep. And we'll be promoting this as well too at the Easter egg hunt. We're doing that again this year, which is great. So that's next week. So, yeah.
And just if people can't make that, we just figured that would be a convenient place within the village. As Jackie said, the med return units are available and are accessible 24 hours a day, 7 days a week. In addition to that, we worked with the New York State Department of Health through the AIDS initiative, and we're able to procure a Sharps disposal unit here, Sharps kiosk. So right now we are the only alternative site within Ulster County where people can come in and drop off Sharps. So 24 hours a day, 7 days a week, they can place them in there. And then we are working with Woodland Pond and other facilities to destroy those. But it's a program that we're really excited to have and available to the community.
It's really important. And just to also make note that for individuals who do utilize Dedrix, Dedrix is a pharmacy that also has a med return unit. So you can, if you're picking up new medication, but you have some old medications, if convenience, it's right there. So of course, it's only available when they're open, but it is a third location. So, and then Jackie, one of the things that you'd be able to pick up if you come to Clean Sweep and you come to the booth are the personal medication disposal bags, which basically are environmentally safe. They hold like up to 30 leftover pills that you could put in there with some water. You seal it up, you shake it up, and you put it in the trash. And it's a way for those people who may be not able to travel or for whatever reason aren't going to go to a medication disposal unit location. They can dispose at home without adding it to the water supply by flushing it down their toilet. We're really trying to make sure that it doesn't get into our water. So there'll be lots of different pieces of information and resources available at that drug take back, which happens twice a year for folks who don't know. It happens the last Saturday in April, the last Saturday in October. We have it running 24/7, but these 2 days are days that we can help rally the community. Spring cleaning, bring in, clean out your medicine cabinets. It's really important on a preventative side on so many levels to not have medications accessible and just forgotten about and there for somebody who might be curious or for somebody who's hurting. And we really want to prevent as much as we can. Thanks.
Well, thank you, Phoenix, Jackie and Jim. We should get updates more often. I think it helps a lot for the town board to hear what you're doing, and I think for the public to hear what you're doing. So thank you very much.
Thank you.
If that's all you have, we will. I'll hand it back to the chief. You kind of touched a little bit on the Oracle and the high risk mitigation HMRT at Ellenville, but we'll go on to number 3 on the agenda. So, Chief, it's over to you.
Okay, yeah, so I think the next item was for the accreditation on-site report and revisions. So DCJS does annual surveys, and then once within the 5-year period, they do an on-site inspection. It requires us to provide our folder proofs to DCJS. And then this year, just obviously due to COVID, the on-site was solely focused on evidence. So the report from the accreditation council came back. There were just a couple things that we needed to revise within our policy. The first was that our evidence needs, we needed to have it stipulated in the policy that evidence needed to be secured in storage prior to the end of the shift. It was something we were doing, but you have to have that written down into the policy. And then also they wanted us to note the specific method of the location of destruction for drugs, and specifying, make sure that we include language specifying the types of testings that when we take evidence to the lab. Those revisions were made. I sent you all, in addition to a copy of the report, I sent you the revised policy related to that and highlighted those areas. That policy has been circulated amongst the membership for review with the supervisors, and then that they'll be signing off on that as well. I don't know if anybody has any questions about that. We are slated for reaccreditation in 2023. So that's down the road, but our proofs are the most difficult part you have with, I was told years ago that getting accredited is easy, getting reaccredited is a lot more difficult, because you're required to make, the time necessary to maintain your proofs is a lot. So, but I'm happy where we're at. We're good, and so it was good to get the on-site inspection done with there. The next item was related to the transmission of data to DCJS, incident-based reporting data. So as I mentioned last meeting, we moved to a new system at the end of 2018. Previously, we reported data via uniform crime reports. Now we're reporting them via incident-based reporting. Our 2019 and 2020 data should be available through DCJS. What we have found is that because we're new to this system, we're in what is deemed a testing phase. In order to qualify or be eligible for us to submit our own data via our portal, we need to produce 3 months worth of report with less than 5% of errors on there. And this is, it's difficult, but it's been exacerbated by a software glitch in the RMS. The county is aware of this, and they are working with the vendor, Tyler Technologies, to remedy that. But in the interim, Sergeant Lewis and Sergeant Quigley are going to continue to work with DCJS to resolve our errors, and then make sure that they are submitting those data sheets into the integrated portal. At some point, I think the county is going to have a dashboard available for law enforcement agencies that are a part of the Ulster County Law Enforcement Records Management System. No date or time as to when that would be up and running, but that's one of the plans. I mean, they're talking about hopefully having something like that within the next 8 to 12 months, but I'm not, no further information or definitive time as to when that would be operational. I'm not sure if anybody has any questions related to the data. Okay. So with that, I guess I'll go to the monthly report. We had just on the cover sheet, the only thing to make note of is that we do have one member that's out on injury, that's been out since February 14th and remains out on injury. And then the rest of this I'll cover in the report itself. In terms of my initial report, as far as meetings and general comments, Just wanted to highlight that at the February 3rd Ulster County Police Chiefs Association meeting, we had a presentation from Assistant Chief Rudolph Hall from the Special Investigations and Prosecution Unit. We're part of the Office of the New York State Attorney General, and this is regarding the Special Investigations Unit and how they will proceed with investigating police misconduct or use of force starting in April 1st. So prior to this, I think it was Executive Order 147 or 47 empowered the Attorney General's office to investigate any use of force by police that resulted in the death of an unarmed citizen. That was expanded in the legislation signed this past summer. So now the AG's office will be investigating these matters. Our policies have been revised or had been revised already to reflect the change in the legislation. So we are all set with that. We were told that most likely there'll be some additional trainings that'll come up as the office gets up and running after April 1st. We had 3 commendations this month. The first one was for Officer Bill Kraus. This was a card that was sent in. Actually, it was an incident that occurred in 2020 outside of our jurisdiction. Officer Kraus had responded to the scene to assist and hold it down for the state police, and the people that were involved were just wanted to write to thank him for his presence, being calm, and keeping them comfortable and safe while they waited for the arrival of the state police to assist. The next two commendations, one was for Officer Kraus, one for Officer Carpinelli, was actually from the same individual. This is an individual that we had here living here locally. Person was just thankful for all the help that these officers had provided them relative to housing needs and some mental health issues that they were experiencing. We were working with Mobile Mental Health and the Adult Protective Services to assist them, and just wanted to thank them for the way they were able to care and treat for him. We have 2 incidences involving defensive action, a total of 3 reports that were filed. The first incident occurred on defensive action report is from February 14th, 2021. It involves a 19-year-old male, approximately 5 feet 8 inches tall, 200 pounds, medium build, white, non-Hispanic. The incident took place, this actually took place in the Mid-Hudson Regional Hospital, this use of force. At the time, the officer had accompanied that individual into the hospital for a mental health evaluation. We had responded to a call for service here in New Paltz. While at the hospital, the individual became upset with one of the triage nurses, had got up and went after the nurse, and then tried entering some patient rooms. The officer ended up grabbing him in a bear hug, trying to get him secured back on the stretcher, and used a leg sweep to direct the individual down to the ground, where eventually they were cuffed with the assistance of security and EMS staff on site. The sergeant on duty responded out to the hospital and began started the use of force investigation. The report findings are that the use of force was in compliance with the department policy and rules and training and regulations. The next use of force, it's 2 reports for the same individual. The individual here in question is a 26-year-old white male, approximately 5 feet 11 inches tall, 160 pounds, medium build, white, non-Hispanic. Ultimately, this individual was charged with resisting arrest and making graffiti. Officers had responded to a complaint in the village, and speaking with an individual who had been suspected with multiple incidences of graffiti. During that time, they began to interview him and he was attempting to leave. Ultimately, this ended up, he pushed one of the officers, and this became a physical struggle, and a struggle that actually lasted about a minute and 30 seconds, a little bit longer, which in that moment can feel really like an eternity. The officers eventually were able to physically direct him to the ground, where they continued he continued to fight with them. They were ultimately able to gain control of him, handcuff him, and brought back to the station for processing. There were some minor injuries. He initially refused treatment, and then ultimately rescue did respond, and he requested transport to the hospital, and jumped out of the ambulance on 299 prior to making it to the hospital. One of the things we did note with this was that the body cameras in this, the mounts, wear over time, and these cameras became dislodged during this struggle. So it was captured on film, but it just the video, because they were able to be dislodged, the angles on and some of it were difficult to view. But so we're in the midst now of working with WatchGuard to procure new mounts. They are under warranty, and we just want to make sure that doesn't happen again. Any questions with either of those? Okay. Just a couple pieces of information in terms of use of force reporting. The first is that I know that in previous I'd mentioned that we report to the FBI on a monthly basis. We no longer are required or allowed to do that. The federal government gets its data from the New York State Department of Criminal Justice Services. So we report our use of force, any qualifying offenses to DCJS, and then they in turn will report to the FBI on anything that qualifies. So we don't make those monthly reports anymore. Just wanted to make you aware of that. The FBI still gets its data, but just comes directly from the DCJS. And then the last, I sent just some information. We don't look at training being just a one-time thing or twice a year. We also look at incidences that happen outside of New Paltz as a way to teach or looking as teaching moments. And in this case, we members here, particularly our two instructors, our defensive tactics instructor, Detective Judge, and our CIT instructor, Phil Kraus, happened to view the pepper spraying of the 9-year-old in the City of Rochester Police Department. And they put together an in-service training, really a training sheet. Well, the training consisted of the officers. They're required to watch the videos, and then they provided a debrief, and in there just talking about things that we've gone over in our training that weren't apparent or didn't appear to have been done there, and just to try to get our officers to see the situation and think about how the training that they've had and how they can incorporate that should they be in a similar situation. So we put that out, and that's also reflected in Lieutenant Butler's training report for this month as well. And we do that periodically. It's not just, in-service training does not just consist of, being in a classroom, whether it be for CPR or on the range or whatever. It's, we try to make it an ongoing process here throughout the year. In terms of the training report, the only thing I really wanted to highlight is the training that Lieutenant Butler completed. He had completed the Daigle Law Group's Advanced Internal Affairs Investigation course, as well as the the standard internal affairs investigation course. These are two 5-day courses, and really, I think they're really thorough, substantive courses. Daigle is outside of his work with training law enforcement. He has done monitoring on consent decrees, so he knows what he's talking about. And this was a really good course, and I think it puts us in a great position where Lieutenant Butler, this coupled with his experience and his certifications and training with use of force, make him extremely qualified now to conduct RIAs and especially anything having to do with the use of force investigation. So I think it puts us in a much better position. That's it for the monthly report that I have, unless anybody has any questions.
I have no questions. Anyone else?
Thanks, Rob.
No problem.
With that, if that's all we have for this, I'd like to make a motion to adjourn the police commission meeting.
Second.
All in favor?
Aye.
All right, 8:18. And I would like to make a motion to open the town board meeting.
Second.
Second.
All in favor?
Aye.
Aye.
And please ask people to stand for the Pledge of Allegiance. Pledge allegiance to the flag
Of the
United States of America,
to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to make a motion to approve the agenda.
Second, Alex?
All in favor?
Aye.
Okay, do I have any announcements? We talked about the Easter egg hunt is coming up. There's still sign-up slots available. I think it's on maybe the youth programs website or the town's website. They've tried to set up a really safe way for kids to still have some fun and get out there, and encourage people to do it. So with that, anyone else would like to say anything?
Yeah, I have just an announcement just on our Reform Commission update stuff. So Monday, they held their third public town hall setting, as long with they've done numerous meetings with groups as well to formulate the report, and a draft report has been created. It's been posted on our website as well. We at the town board are waiting for the final version of that. Once we get that, as I think we talked about earlier, on April 1st, we will then be able to vote on that proposal and send it up to the state. I just want to be really clear, though, about this. I think there's been a lot of conversation on what is in the report, and what is in the report is important, but ultimately, really the action that happens from that report is on us as the town board and as the police commission. So I just want to be very clear about that what this process is more of the beginning of a conversation. It's about creating a community review, and it's about starting this dialogue. Just speaking for myself, and I think I can actually speak for my colleagues as well, we're up for that challenge to do that and have these conversations. And I think that this process has been very helpful in creating that dialogue. We're having it now. We've had it almost every police commission meeting as well, but the process doesn't end on April 1st. If anything, that was, I would argue, the easy part. That's just the beginning of the process. And so I say that because I know that there are going to be a lot of opinions on what is in and what is not in the report, but ultimately it is on us to then take that and turn that into an action plan. And I think we're committed to doing that. My last point to it as well is just that we have not been notified by the state that the deadline has changed. So that's information that I just haven't had verified from the state. But at least at this point, having spoken with the committee recently, they're making some updates based on the most recent review session that they had with people and some of the feedback that they did receive. Once they do that, they will provide us with a final draft. We will post it online. And I'm sure at our meeting on April 1st, we'll have, a final draft. And then we'll have 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 a final draft. And then we'll a significant dialogue on that as well too. So that was just the update I wanted to provide on that.
Great, thanks, Dan. Any other announcements from town board members? If not, we will move on to public input. And so if anyone has any comments they'd like to make, please raise your hand, and we're happy to hear them. You know, we're, as usual, trying to keep it to 3 minutes, but you know, we also want to hear everyone. So please raise your hand and we'll unmute you. And Maggie, you have some more things to say?
Well, this is the real Maggie, okay? So, yeah. Well, I guess I missed whatever part of the meeting some other Maggie may have had a conversation with you, but yeah, I wanted to say that number one, I'm glad to hear that what Dan said about that the report really is a beginning. You know, because there is significant information in there that I really think does need an extensive conversation, and that conversation doesn't have a deadline for April 1st, so that's very good. I also want to add that I need to understand how those conversations will go in relation to, you know, will they be typical meetings of the town board where there's opportunity for public input without a conversation. So it, you know, there's so much information in there that I'm trying to get, and certainly an interest in having feedback that is useful to both sides of any discussion. And so, you know, I'm hoping that you can come up with a plan that talks about having conversations more than simply having public meetings to listen to what somebody says and go on to the next thing that somebody says. There is a need for genuine dialogue, and I'm hoping that that can be a part of a plan that you develop whenever you decide to go forward with talking about the plan. That's number one. And number two, I simply want to understand, do you see you are acknowledging this plan or accepting the plan? There was a conversation about that with the county legislator. Eve Walters was talking about that with many of us who were on there. And, you know, when one doesn't want the parts of the plan, you may not want parts of the plan. There's a clarification needed to see, when you take this plan, are you accepting it as this is what should be done? Or are you accepting it, just simply acknowledging it because it's something that you need to send forward to the state? So it's a question that maybe it can be answered at your interest and your will.
You're muted.
No, I was done. That's all.
Okay, great. Thank you.
Yeah.
Thank you.
Tanya?
Okay, can you hear me?
Yes.
Okay. Well, one is a simple question. We knew that the state was going to allow plans to come in after the 1st because they are nowhere prepared to take 500 plans in one day. And they specifically stated that with a phone call that had been made to that office. But Dan said that the date was extended. But what he didn't say is what that date was, because I assume that the board is going to have to adjust their thinking to that extended date. And I think that we, the public, need to know that as well. I just want to also second, you know, Maggie's position that this is a very profound concept, the EO 203, and is definitely something that does not get discussed in 3-minute public input comments and move on to the next person. And I really hope that despite a previous comment that you made during the police commission, that you really rethink how we are going to set up real public dialogue, because it's a very complicated issue. And dealing with racism, which is not well understood by many people, I think that we really need to afford ourselves and the public the time to really explore it in great detail and have meaningful dialogues and conversation in terms of general overview as well as the specific processes. And I think we all understand that no change is going to happen overnight, other than the most minor things, that this is something that is going to be a proposal of goals to reach over a period of time, with certain goals being able to be met sooner than others for many, many reasons that I don't have to elaborate now. So thank you.
Thank you. Carol? Nolan?
Hello. This is actually not about police reinvention. I am curious to know what's going on with Water District 5. I heard some scuttlebutt that maybe all the lawsuits were taken care of and maybe there was going to be some movement, but I haven't seen anything publicly that talks about that. So I'd appreciate an update, maybe on your website, maybe in a meeting. Thanks.
Sure, we don't normally give updates on this. The update is, yes, we did when we have won all the lawsuits. We're waiting to hear from DEP to see if they want to go forward. And hopefully we'll hear something soon.
Okay, thanks. Anything that comes up on your website would be appreciated.
Yeah. Yes.
Okay, thanks.
Edgar?
I think you're on mute, Edgar. Hold on one second.
I asked him to unmute.
There you go.
I was saying that I won't need 3 minutes. We submitted to the actually to all 10 elected officials in New Paltz a 19-page document that's been created over a process of 10 months, carefully written and thought out. I'd like to know, one, what is the role of the village board in the process of 203 or after April the 1st? Because it is called the New Paltz Town and Village Police Department. Second, how will you include in discussions this document from the community that's called booklet number 3, because we've issued 2 other booklets before that, called Imagining Community Safety and Wellbeing, a framework for New Paltz in 2021 and beyond. So that our vision has always been that, as I just indicated earlier, that this process will start after April the 1st. And we are working with a large number of people in the community to be able to be involved after 10 months in a public dialogue, 2-way conversation where the question of having 15 seconds left or 2 minutes, etc., is not there, where it's, and that is possible. We just had a meeting like that. And that's critical that there be open 2-way discussion with the town board, I believe with the village board also. Can you give me some kind of assurance now in public that our document will be considered? And also, do you acknowledge having received it?
I'm happy to answer that. Edgar, I have received it. I will be honest, I have not reviewed it yet, but I plan on doing so. I'm also aware that the Reinvention Committee has received it, and they're looking at ways to incorporate elements of that as well. I don't know what that'll look like. I just know that that was just a conversation as a follow-up meeting to the Monday meeting that I had with them. As for the component with the village, and I don't know the exact wording because I don't have the executive order in front of me, but obviously there was a conversation about overlapping jurisdictions being involved within the 203 process. But the village itself doesn't have a role in policing because they, if we want to go to the history of it, I believe they forfeited the right for the police of New Paltz in about the 1970s as well. So when it comes to funding or any kind of policy issue with the police, the village of New Paltz just doesn't have a realistic role in it, just because they're a governing entity that doesn't do anything. Just like we don't do water rates that the village does, they don't do policing.
Is there an interest on their part to participate? I mean, they're an important segment of our community, and they should be involved in this discussion formally as a stakeholder, as another stakeholder group. I understand the technicalities, but again, that's up to the village board. They've expressed some interest with us, and so I would, I hope that their voices are also heard as we proceed after April the 1st. Thank you.
Yeah. Yeah.
They have as much right to be involved as any resident of the town or village has to be involved, you know, and we value their input just like we value your input, Edgar. From a policy standpoint, they don't. You know, that's just the way it is. They're not tasked with being in charge of deciding the budget for the police department. That's our job. So they have ideas. We talk to them. We have a lot of communication. They probably have more say than someone else does, just because, you know, we interact a lot more. And, you know, I'm probably on the phone 10 times a day with them. But
just a technical question: do they contribute financially to the police budget?
No.
No. Okay. Thank you.
Anyone else have any other questions?
So
How you doing?
oof,
Hey, I'm in a meeting. I gotta go.
I don't care.
So with that, if we don't have any other questions, I would like to maybe move on to the first item on the agenda. I think Mr. Matera, you are here. Is it Pete? If you can,
Okay.
you'd like to address the board?
Yes, thank you. It's Peter Matera. I had written a letter, and I appreciate you putting me on the agenda to address the issues I raised. I represent Dimitrovitz, who own the property at 11 Old Route 299 in New Paltz. And this is in regard to the water bill, sewer bill re-levy on their 2021 taxes. So I had outlined this in my letter, but basically the issue is that they had a commercial tenant in the property for a number of years. And I guess during that time, the water district or the water department was giving inaccurate bills to the tenant. And then after that tenant left, you changed the meter. And as a result of that, there was over $14,000 in unpaid sewer bills that were never charged to the tenant. And now they've been re-levied in the tax bill, as I indicated. The issue that I have is the tenant was billed. The tenant was the one on the water sewer bill. The tenant was the one who used the water, and now the landlord is getting hit with this bill. And quite frankly, putting the legal issues aside, it's not fair. And I'm asking the town board to address this because it's onerous and quite frankly, it's wrong. So that's why I wanted to address the board.
So, yeah, you know, thank you. I don't know if any of the other board members want to, you know, talk about this. I mean, we need to be clear, the meter wasn't faulty. You know, the way they work is there's an outside reader and an inside meter. And you are correct. We were sending bills based on the outside reader. And then when the meter was switched out, the difference of what was actually used was billed. In the end, when you go on, you know, in the end, you know, the owner of the property is ultimately responsible for the bill. You know, we did contact the the Demetrius several times and asked them to contact us, maybe set up a payment plan. We never heard anything back, which is why we put it on the taxes, because that's ultimately the only way we have to do it. And so that's kind of where we are now. And, I guess we can discuss it as a board, how we go forward. We're not, normally allowed to give services away, which is, the services were provided by using the sewer, so we have to figure out some way to solve that problem, and we can discuss it.
So just to clarify, at some point I did reach out and advise that we were trying to get in touch with the former tenant. And I thought it was not going to be levied on the taxes while we worked on that. But then when the tax bill came out, it was there, and it may have been some miscommunication between the woman, I apologize, I don't have a name at the tip of my tongue, but the woman I was dealing with and me. But that being said, I understand you can't give away services, but services were rendered, they were billed for, so there was an account that was stated and it was paid. So it may have been the outside reader that was at fault, but how do you come back now I don't even know how many years that meter I think was replaced 12 years ago, if I'm not mistaken, and say, okay, you use services, whatever, 6, 8, 10, 12 years ago, and we're going to bill you for those, even though you yourself didn't use them. So I understand it's a mistake that's made, but it's a mistake that becomes onerous on the owner, even though he didn't benefit from it.
No,
Just
I get
fundamental fairness here.
Yeah, the problem is the code, that, the town law states that, if the water passes through the meter and the reading is there, we have to charge for it. That's what's in the code. And the code says that the owner is ultimately responsible for paying the bills.
Okay, so then putting aside fundamental fairness, let's look at the law on it. How do you come back and demand payment for something that's so old? I mean, is this something that was actually discussed with the town attorney or any attorneys as to your rights to go back that many years and look for payment?
I think there is a 7-year statute of limitations.
I'm 7 years old.
Okay, so, but I think this goes back much further than that. Correct me if I'm wrong, but wasn't this meter last changed about 12 years ago?
It depends when the last inside reading was, and we can go back and look at when the last inside and outside reading was done. And we're happy to go back and look at that. And we have adjusted bills in the past for that. And so we can do that, and we can talk to our attorney more and find out exactly what the statute of limitations are on it, and we can get back in touch with you. I mean, but
yeah, and I would appreciate that because we want to resolve this by the same token. It's actually, I think it's closer to $15,000. Over $14,000 is just it's almost $15,000. I think that was re-levied, which is an outrageous sum for anybody to be able to pay. And given the circumstance, I mean, if he actually used the water, this conversation, if we were having it, would have a much different tone to it. Or in this case, not the water, the sewer, but either way. But given the fact that he really didn't benefit from this, there's a legal issue and there's a fairness issue, and that's what I'm asking you to take a look at, and I appreciate that. I'd also like to know, is there a way that we could, rather than wait for the next town board meeting, is there a way that we could address this more quickly?
We can talk offline. I'm happy to do that with you.
Okay, so is there a time when I should reach out to you, or would you prefer to reach out to me? Or
I can call your office on Monday if that works out, and we can try to set up some times at work.
That would be great. And again, I really do appreciate it because I've spoken to you before and you seem like a very reasonable person and you care about what's going on. And this is something that I do think deserves a little more looking at than the average situation where you say, well, no, we just misbilled once or twice or something like that.
Yeah, I'm happy to do that. I'll reach out on Monday.
All right. Thank you very much. And I appreciate the board's time as well. Thank you.
Sorry it took so long.
No, that's
on the
okay.
agenda.
Does anybody have any questions before I sign off? All right, thank you. Good night.
Good night. Thank you. That I'd like to make a motion to approve and authorize items 2A through 2F on the consent agenda.
Second.
All in favor?
Aye.
Oh, wait, and then actually 2F through 2G. G should be on there too, right? What is that? Sign.
Labor contracts for 2021.
Yeah. So authorize 2A through 2G.
Second, Alex.
All in favor?
Aye.
Aye.
And I'd like to make a motion to approve the March warrant in the amount of $929,536.99.
Second.
All in favor?
Aye.
All right. And with that, I'd like to make a motion to adjourn.
Second, Alex.
All in favor?
Aye.
Aye.
It is 8:43. So thank you, everyone.
Thanks, Neil. Thanks,
Thank
Guy.
you.
Thank you. Bye-bye.
Bye.
Bye.